Have you ever stopped to think about your body as, well, as a building? Not just any building, but a brilliantly designed, self-repairing skyscraper. Today, we're going to take a look at the steel beams that give it incredible strength, the elastic mortar that keeps it flexible, and the amazing communication system that runs the whole show. So let's start with a really basic question. How is it possible for one structure to be both super strong and incredibly flexible at the same time? I mean, think about it. Your bones are rigid, your tendons are tough as nails, but your skin can stretch and your lungs can expand and contract with every single breath. What's the secret sauce here? Well, the answer is hiding inside your cells, and it comes down to two protein superheroes. And no, I'm not kidding. These guys are the literal steel and the elastic mortar that build pretty much everything from your bones all the way down to your blood vessels. And that brings us right into part one, strength and stretch. Let's get properly introduced to the two key proteins that form the very fabric of you. All right, first up, meet collagen. You can think of this as the body's high tensile steel cable. It is, by far, the most abundant protein in your body. And the secret to its incredible strength? It's all in that triple helix structure. Just imagine taking 3 strong protein chains and winding them together into a super tight, super strong rope. That design is what gives your tissues their amazing resistance to being pulled apart. But here's the thing, you don't just get these perfect steel cables out of nowhere. Your body runs this really sophisticated multi-step assembly line to manufacture every single strand of collagen. It's a process that's so complex, it actually starts inside the cell and finishes outside of it. So let's just break it down into 3 absolutely crucial steps. First, it all starts with a blueprint inside the cell. Next, and this is a big one, a critical modification step has to happen that requires vitamin C. Seriously, without vitamin C, this step just fails. And finally, the individual units get shipped out of the cell where they get assembled into these massive, strong fibers. So what happens if that essential vitamin C worker doesn't show up for its shift? The entire assembly line grinds to a halt. The body literally can't make functional collagen, and that leads to scurvy, a horrifying disease where your tissues actually start to fall apart. It's a pretty stark reminder of just how critical a single molecule can be. Okay, so if collagen is the steel cable, then elastin is the body's elastic mortar. It's the amazing protein that allows tissues to stretch out, and then, this is the key part, snap right back into shape. Think about your arteries expanding with every single heartbeat, or how your skin bounces back when you pinch it. That recoil, that's pure elastin at work, giving you the flexibility that perfectly complements collagen's rigid strength. And when you put them side by side, you can really see how different their designs are. You've got collagen's super organized, rope-like helix that's built for raw strength. And then you have elastin's loose, kind of messy, cross-linked network that's built to stretch and recoil. It's just 2 brilliant designs for 2 totally different but equally crucial jobs. Okay, so we've got our building materials, right? We have the steel and the mortar, but a pile of building materials doesn't just magically become a skyscraper. It needs a foreman, a project manager, a communication system. So who or what is telling the body when and where to build or repair or regulate itself? And that question leads us perfectly into part 2, the chemical messengers. We're now shifting gears from the body's architecture to its incredibly complex body-wide communication network. Now, your body actually has 2 main systems for sending messages. You've got the nervous system, which is kind of like having dedicated fiber optic cables running everywhere. It's incredibly fast, sending specific messages that are over in a flash. But the endocrine system, which is what we're going to focus on, is more like a wireless broadcast. It sends out chemical signals that travel a bit slower, but can have really broad, long-lasting effects. And what are those wireless signals? Yep, they're hormones. Different glands release these chemical messengers straight into your bloodstream, and from there, they travel all over your entire body. But here's the cool part. They don't just affect every cell they pass. They only work on cells that have a specific receiver that's tuned to their unique message, kind of like a radio picking up just one station. So, how do these messengers actually deliver their instructions when they get to the right address? Well, they've got 2 main strategies. The first group, they're pretty polite. They just knock on the cell's door. These are your water-soluble hormones. They physically can't get through the cell's outer layer, so they bind to a receptor right on the surface. That binding action is like ringing a doorbell, which then activates a second messenger on the inside to carry the instruction the rest of the way. So the key here is the message gets delivered, but the original messenger never even steps foot inside. This system is perfect for super fast responses, like turning existing cellular machines on or off in an instant. But then, you've got the second group of hormones. And these guys, they don't bother knocking. They've got an all-access pass, and they just walk right in. These are the lipid-soluble hormones. Because they're fatty, they can slip right through the cell's fatty membrane and find their receptor waiting for them inside. This new hormone receptor team then travels to the cell's command center, the nucleus, where it directly messes with the DNA blueprints, telling the cell to start making entirely new proteins. This process is a lot slower to get started, but the effects are deep and long-lasting. You're not just flipping a switch anymore, you're fundamentally changing what that cell does. Okay, so now we get the materials and we get the messengers. For our last section, let's take a quick look at what happens when things go wrong, either with the architectural blueprints or with that crucial communication system. Here's a perfect example of an architectural flaw. With Ehlers-Danlos syndrome, the body has a faulty blueprint for making collagen, and the consequences are exactly what you'd expect if your steel cables were defective. Joints become way too mobile, skin gets overly stretchy, and the body's tissues just lose their structural integrity. And on the flip side, here's a communication breakdown. Cushing syndrome is caused by way too much of the steroid hormone cortisol. It's like one of those messengers is just screaming its instructions nonstop, 24/7, completely overwhelming the entire system. It's a powerful lesson in how just one broken communication line can mess up the whole building's operations, leading to this cascade of problems affecting everything from your metabolism to the strength of your bones. So when you zoom out, the big picture is just this. Your body is a dynamic masterpiece. It is constantly, every second of every day, balancing the rigid strength of collagen with the snappy recoil of elastin, all while being directed by a flood of hormonal messages that control everything from your mood to your metabolism. It's an incredible, invisible dance. And that kind of leaves us with one final thought to chew on. This incredibly complex system of building and communicating is happening inside you right now. So the real question is, when you think about everything from the food you eat, like that essential vitamin C, to the stresses that influence your hormones, how is your lifestyle helping or maybe